What are bottle babies? Besides being the cutest things ever, bottle babies are orphaned or abandoned kittens that range in age from newborn to between 4 to 5 weeks old. They do start to kind of be not considered bottle babies when, of course, they are no longer on the bottle and they do start to wean onto solid food. These kittens are unable to be reunited with their moms for a variety of reasons. For example, mom might have rejected them. They could have been found outside and brought to one of our shelters, or mom might have passed away, or for whatever reason, they have been separated from her and they are not able to be reunited with her. Bottle babies are unable to eat or care for themselves. They are extremely vulnerable at this age range, and they do require our full support to be able to survive. Understanding the risk with these guys. The mortality rate for kittens under 6 weeks of age is higher than that of an adult or an older kitten. Orphan kittens have an increased risk of disease and complications. Many of them do arrive into our care already sickly to different degrees from a lack of care during the duration when, they were last with their mom, to the point of them coming into the shelter for care and then eventual foster. This can include internal or external parasites, disease, and or a lack of proper nutrition, which can play a major factor, into their just, vulnerability and, risk involved with them. Even with the best care, some kittens may not make it. Unexpected death and euthanasia is an outcome that can occur with these guys. We do try our best, to help this vulnerable population of kittens who wouldn't naturally be able to survive on their own. And we do recognize bottle babies are a lot of work. They, require 24/7 care. And it is really important us as foster caregivers, to recognize when you do need time off or a break, just because they are very, demanding on our just day-to-day schedule and, emotional and physical, mental, the toll does start to add up sometimes with these guys. And, again, like, we are all trying our absolute best to support this population that wouldn't naturally survive on their own. But, we definitely want foster caregivers to recognize when they do need a break or time off. And it is important, for all family members when we are fostering these guys, just to understand these risks, because we recognize it's a very hard thing to go through. Even with the best care, some of these kittens may not make it. No matter what we do and what we try, unexpected death and euthanasia is an outcome that can occur for them, especially at such a young age. Again, no matter what we are able to do, there is definitely risk involved with, just because they are so vulnerable. And then fading kitten syndrome is something we encounter, and, is probably the most common cause of unexpected death or euthanasia for a kitten that is considered a bottle baby, which pretty much just refers to a kitten's failure to thrive during this vulnerable period from birth to when they are weaned onto solid food. The causes of fading kitten syndrome is a whole bunch of things. It's not, a fully understood thing in itself. It, covers a lot of different things that could be going wrong with a kitten, and we kind of just call it fading kitten syndrome, because sometimes we're not able to really figure out what is going on. No matter what medical intervention we take, sometimes it can be idiopathic, which pretty much just boils down to it's an unknown cause of death or decline, which might end up in a euthanasia decision. But then also it can be noticeable developmental issues or congenital abnormalities that maybe the kitten was born, already with something going on internally that does impact its ability to thrive and be able to grow and, develop into a normal, healthy kitten and eventual adult cat. We supply, as much medical and supportive care, within our capabilities. But again, some kittens, when they do start to decline, may not be able to turn around and recover. And in those cases, euthanasia can be, the kindest option for them. And, despite a combination of, medical intervention, supportive care, all of those things, it could be a combination of, all these unknowns that could result in that kitten's death. And, we just want, fosters kind of going into this to, have that understanding and, expectation that this can happen. But again, of course, we are here as foster coordinators, and our veterinary team to support our fosters and their foster pets, as much as we possibly can. But it is something, we all as foster caregivers have gone through. So, we just definitely want, people going into this to, just kind of understand that risk. And, again, like I mentioned prior, to also, as family members, within the household, to also, have an understanding of that risk, because, we recognize it's a lot and it takes a toll on all of us, of course. And, we are here to support our fosters through it, when these things do happen. So yeah. And on to happier things. So what to expect with these guys, but as always, we expect the unexpected. So with these guys, starting from birth until they are weaned, we're going to be planning to feed them every few hours, depending on the age of the kitten. So we do it more frequently the younger they are, which until, usually they're weaned. That does mean waking up at least, a few times to once throughout the night to be able to be feeding them, on a 24/7, every few hours type of schedule. We are going to be bottle feeding them till about 4 to 5 weeks old. Kittens are to be kept in a top loading carrier or an incubator to start, especially when they are super, super small. We want them in a really small, case, where they can, be safe and secure and close to heat supply. But then they'll graduate to like a larger crate and then eventual smaller room. So they start off small and then they can gradually have more space, as they age and, are a little bit more hardy as they get older. Lots of poop with these guys. There's a lot of poop. Sometimes there can be pooping problems, as we refer to it. So, we want our fosters to be able to have the ability to identify when medical care is needed. For diarrhea, to be able to report any concerns to their foster coordinator with these guys. And then in the end, it is super rewarding knowing that you truly save a life with these ones, because again, they are a very, very vulnerable population. They require a lot of care and monitoring. But, when we can, be that surrogate mom for them and, raise them to the point of, adoption and finding a new home, there's not many things that can kind of beat it, because you truly have saved a life. So, it just in general is like one of the most rewarding things to, know that you did that. So yeah, great job. So developmentally, so kittens that are under a week old, so they're about the size, they fit into the palm of your hand. They can't regulate their body temperature or eat on their own yet. Their eyes are shut, ears are flat to their head. Their skin is like pink tinge. Part of the umbilical cord might still be attached. Generally, that little piece does fall off 3 days post-birth. Roughly, it's not, an exact science, but there's usually like an inch or so that is still attached to them at that age. And then again, they are going to be able to fit into the palm of your hand. 1 to 2 weeks old. So, these guys, they still are not able to regulate their body temperature or eat on their own, but their eyes are starting to open. And typically this is going to happen between 7 to 10 days after birth. Their ears are still flat on their head and their tail still kind of like sticks straight out behind them. They are starting to become more mobile. So you're going to start to see them kind of crawling around a little bit more and bobbling around to kind of, just kind of explore their environment. But again, their vision is still pretty blurry, even as their eyes are starting to open. So they kind of explore their environment, just kind of like bopping around a little bit there. Then you are going to start to see kind of some teeth come through. So it's going to be the smaller teeth that are just right at the front, which are the deciduous incisors. So those are just kind of the first ones that start to grow as they get a little bit older. 3 weeks of age, they still can't eat on their own. Theme of the bottle babies is they can't eat on their own, so they need us for that. But their eyes are fully open at that point. Their ears and their tail are starting to stick up and out, just like, you're starting to see them as like an actual kitten, and starting to take on more of those, like cat characteristics. They're going to start to walk around. They're going to be a little bit more wobbly. So they're just very unsteady on their feet, and they're kind of like drunkenly bobbling around, just kind of exploring their environment. But they're definitely a lot, more curious and more, exploring, and kind of go on a little bit more adventures. But, again, they still definitely need a safe, secure, enclosed space to when they are starting to explore, because they definitely shouldn't be walking around full roams and getting stuck anywhere or anything like that. They definitely still need to be confined and contained for their own safety. And then their canines are going to start to appear. So you're going to see just, the top and the bottoms right to the sides of their front teeth are going to start to come in as well at this age. 4 to 5 weeks. These guys at this age are going to begin to wean onto kitten food and start to use their litter box. Their eyes are going to begin to change from blue to another color, whether sometimes they might even stay blue, they might turn green, a little bit yellow. Typically, most often, it's going to be a green of some sort, but sometimes you might, luck out and they'll stay blue, but usually this is kind of a range where their eye color is going to start to change. Their deciduous premolars are going to start to come in, so the teeth between the canines and their back molar teeth, so it kind of starts from the front and works its way back. And then they are going to start to play and explore and just become, even more curious during this time frame as well. And again, still being in a safe enclosed area, but they can start to have, more access to their environment to start to play around in, as long as it is, of course, kitten proof and kitten safe. So to start, what do we need to supply? So first and foremost, we need these guys to be warm. So kittens under 4 weeks of age cannot regulate their body temperature and do need to be provided with supplemental warmth. The temperature range by age that, they need to be maintained at, from 0 to 2 weeks old, they need to be between 88 to 92 degrees in their environment, just because, again, they are not able to self-regulate their body temperature. So they do need to be in an environment where that, temperature is, as close to that degree range as possible for them to, continue to be healthy and, be able to grow. And then as they get a little bit older, between 2 to 4 weeks old, that can kind of drop to 80 degrees roughly, because again, they start to regulate their body temperature, but they're definitely not, all the way there yet. So they still continue to need that supplemental warmth in order to, stay safe and healthy. Warmth itself can be supplied in a few different ways. What usually is kind of the best for them, for just fosters in general to have these supplies on hand, is to utilize a top-loading carrier. So seen on the right-hand side there's that carrier right in the middle that you can open it from the top. And then we have Snuggle Safe discs, which is that disc right on the bottom there in that photo, the pink guy there. The ones that we have most often at our shelters has like a fleece cover that can be removed and washed, if it gets dirty. But those reheating discs, they do require us to kind of stay on top of them to continue to reheat them in the microwave, but they do last for multiple hours, at a comfortable temperature for these kittens. But it's just, something that we do have to stay on top of to make sure their environment, and that they have access to that warm disc to be laying on top of, during this couple week time frame to make sure they stay at the right temperature. And then the carrier itself should be big enough. So, the kittens, one half can have the heating disc, but also on the other half, they can still have, comfortable blankets, just from a softness perspective and comfort perspective, but also, the one that doesn't necessarily have a heating disc under it, just because we want the kittens to have the ability, if they do kind of get too hot, to be able to move away from that heat source. And then with the carrier itself, when the kitten's just in it, staying comfortable, you're not feeding it or anything, you just want to put a cover over the carrier just to kind of keep that warmth, in the carrier itself, so it's not dissipating into the environment. So you want to put a little bit of a cover over it, just to kind of keep things enclosed and continue, to keep the heat in as much as possible, but also so it has airflow so the kitten, of course, can breathe. And then occasionally, not every shelter always has one of these at its disposal, but sometimes we do have incubators available, and your foster coordinator will be able to provide definitely more instruction if you're ever going to take an incubator home with a kitten, just because there's particular ways they need to be used and operated. But incubators can be really great, especially for those kittens that are between the 0 to 2 week range, just because they are able to have a set regulated temperature. You're able to have humidity put in there. So, it's like a comfortable, temperate environment for what the kitten needs at that age. So we've definitely found it to be very successful with like the few day old ones and things like that. However, they can still be successful just utilizing a top loading carrier, but occasionally, we might have incubators that we will send with our fosters there. And then next, what else do we need to supply? So next is going to be elimination and hygiene. Kittens under 4 weeks old cannot go to the bathroom on their own. Normally, that's what mom's job is. She's going to lick them to stimulate them. But of course, if mom, is not in the picture, then that's where we step in. So before feeding time, each time you're going to want to use a cotton pad or, a piece of tissue to very gently rub the genital anal area of the kitten. You can make it a little bit wet, but only the little bit. Usually you can still keep it dry, and it's going to work the same. It just kind of mimics the feeling of mom's tongue. So you're going to want to avoid using like any rough paper towels or hand towels or anything. It's definitely, we found the best, and easiest is going to be like some sort of cotton pad that usually, we have at home already, or just a tissue that also works just fine. So kittens should pee each and every time you do that before feeding, and then they should poop once a day, up to every day and a half. We definitely encounter with these guys, sometimes they can have some constipation issues, which we'll touch on in future slides. So they're not always the most regular when it comes to pooping, but the ideal is they are going to be pooping once a day, up to every day and a half. And then once they do go to the bathroom, you're going to want to pat the area dry with a soft towel or, another dry cotton pad or tissue. And you're going to want to keep an eye out for any chafing or rawness going on down there. Because sometimes we might have to, put a salve or something on there if they are starting to get red at all. But if you're doing it very gently and drying it, as much as possible each and every time after they go to the bathroom, that should kind of keep any irritation at bay. But then sometimes baths might be necessary to remove urine or feces if they do get, really gross back there, especially if they have any diarrhea. So you can hold them gently under warm water using a very small amount of Pet Safe shampoo or soap. Of course, just kind of putting only the necessary dirty bits underneath the water. And you're going to want to definitely avoid the nose, eyes, ears, and again, keeping the kitten as dry as possible and only getting that little area that you need to wet. And then once you're done, dry and, rinse the kitten off, immediately and thoroughly to make sure, to make sure it gets warm again as quickly as possible, because warmth is very important for those guys. And then we have a video that I'm going to pull up and play, just to kind of show, how to help them go to the bathroom.
Hello! Hi everyone. Today I'm going to teach you guys how to stimulate kittens to go to the bathroom. When kittens have a mother, their mother uses her tongue to lick the area all around their genitals and on their little butts to help them pee and poop. But when they are an orphan, like B here, you have to help them do that. No, you do not have to lick them, but you do have to help them go to the bathroom every single time they eat. The way you're going to do that is by gently rubbing them all around this area to stimulate elimination. At home, I prefer using a soft tissue like this and just keep a box of tissues next to me. I'll bring some Kleenex with me in a packet. Just throw it in my bag so that I have something to use when I'm on the road. But even if you're out and about with your kittens, you can grab a roll of soft toilet paper to use. You don't want to use anything that's too rough. You don't want to use, a paper towel or a hand towel from a public restroom or anything that's going to be too rough. You want something that is nice and soft. You also might want to grab some organic baby wipes, something that's fragrance-free and gentle to help clean them up after they've gone to the bathroom. And then, of course, grab some hand sanitizer or some soap just to make sure you're keeping yourself clean after you do this. So I grabbed my tissue and I'm about to stimulate him. Some people will dunk this in a little bit of warm water just to make it wet. You don't necessarily have to do that. The most important thing is that it's soft and that you're not rubbing too hard. And I prefer to do it with them on their back so that I can see what's going on. It doesn't make quite as much of a mess. You can easily tell when they're done. I do this every time before I feed them. You'll be surprised how fast this food passes through their bodies, especially when they're this little. And I just very gently stimulate. You can see she kind of relaxes when you start to do it. And you can see that the tissue is becoming wet. I'm going to just keep rubbing until I see that she's no longer peeing. And you can see that she's also going to poop. Now, kittens should pee every single time that you feed them, but they should only poop a couple times a day at this age. When they get older, it's normal for them to poop maybe once a day. And it's normal for bottle baby poop when they're this little to be pretty yellow. The important thing is that it has a solid form. So you can see that his is, somewhat solid, but a little bit loose. Not the most perfect poop, but not too bad. So that's what a bottle baby poop kind of looks like. So now I'm going to take my organic baby wipes and I'm just going to clean him up. One thing that happens with kittens is they get something called urine scald. So when you're peeing them, you can see the pee is kind of going all around. And even if it seems like it's dry, you still want to wipe the area because they're so sensitive that if urine is building up in this area, it can actually burn their skin. And you can end up with a kitten that has a very raw, irritated backside, which is not good for anybody. If you do find that your kitten has a really sensitive butt or is really raw down here, you can help give them a little bit of comfort with a soothing product. Something like Aquaphor is really good. This is just an ointment. But of course, the most important thing is to help just keep them really, really clean after they pee and poop. So she's a good example of a nice, clean looking kitten. Her butt looks very comfortable. Her fur is soft. If you get a kitten that has serious mess back here, something I like to refer to as a poop explosion. If they've got a lot of poop or a lot of urine residue back here, then you're going to want to do more of like a dip in warm water with some dish soap or some baby soap just to keep this area nice and clean. So once they hit 3 weeks old, you can introduce them to a litter box and get them trained. But until they reach that age, it's your job to help them go. Be really careful if you see diarrhea in these guys. Diarrhea can be a big issue for a tiny neonate because they can dehydrate so quickly. So if you're seeing diarrhea, make sure that you're also supporting them with fluid. Sometimes you might even have to do subcutaneous fluids on a kitten that has diarrhea. And of course, try to address the problem by making sure you're feeding the correct amount, that you are treating them for any parasites they might have, and talking to a vet and getting a fecal analysis if you're concerned about what their poop looks like. So I know this lesson might seem a little bit gross if you're not used to helping little kittens go to the bathroom, but this is such an important part of their care routine. So you have to be comfortable doing this. You have to be comfortable doing it many times a day every time they eat. Remember that you are saving these little guys' lives and giving them an opportunity to survive when they don't have a mother. So thank you for saving them, and check out the rest of my videos to learn how to care for them. What are you doing? Good morning, kitten ladies and gentlemen, and good morning to you, Zuma. I am reporting live from the kitten bathroom where I am about to give the kittens a bunch of butt baths. These guys are just over 3 weeks old, and one of the things that starts happening between 3 and 4 weeks old is they start to discover the litter box. These guys haven't quite mastered the litter box yet, So sometimes in between their feedings, they will accidentally poop on themselves, doing what I call an oopsie poopsie. Who's got poop hanging from their butts? Is it you? Oh yeah, you got poop hanging from your butt. Ew, yeah, you got poops. Balboa looks nice and clean though. Good job, Balboa. Now these guys are orphans, and if they had a mom cat, their mom would be meticulously cleaning them. I do the same thing with baby wipes, but sometimes the oopsie poopsies are a little too strong and they have to get a butt bath. You have to be really careful when you're bathing these little guys because they can't regulate their own body temperature. So you have to do it quickly in a way that's warm and that doesn't stress them out. So this morning I'm going to show you guys how to do a safe and easy butt bath on a kitten. I want to make sure these guys are going to be warm when they get out of their bath. So the first thing I do is heat up a heat pad and stick it right under a soft baby blanket. That way the baby blanket can get nice and cozy and warm so that when they get out of their bath, they have a warm spot to return to. Come on, Zuma, let's go. Kittens can get cold really easily, so it's important that you get the temperature right. While that's warming up, I'm going to grab some washcloths. All right, my water's nice and warm, so I plug the sink and I get ready for Zuma's bath. I'm just soaking Zuma's little butt in the water. You never want to dunk more of the kitten than needs to be cleaned because this is a really stressful thing for them. So I just dunked their bottom half in there. Since Zuma's pretty crusty, I'm going to let her soak for about 30 seconds. Now there's a couple different products you can use for this. You can use dish soap, which helps break down oils. Or you can use an unscented baby shampoo. I like to use baby shampoo for these little guys. It's pretty gentle. I prefer one that's fragrance-free. I prefer one that's cruelty-free and organic if possible. The one that I'm using with them is just a fragrance-free baby bath that is not tested on animals. Okay. I'm not washing her entire body. I'm just washing the parts that have poop on them. I try to do this as quickly as possible, but also as thorough as possible because I don't want her to have any poop left behind. Now I am going to rinse her butt with fresh water. Of course, I don't want to rinse her butt with the dirty poop water. I just run some water over her tail, always protecting her face, always protecting her eyes and ears and mouth. Just rinsing the butt. Just a little butt bath. And that's it. Then you can dry them off. Kittens don't like being wet, so you want to try to get them dry as fast as possible. The first method for getting her dry is just vigorously rubbing her with a washcloth. Another method you can do is to back comb the kitten using a toothbrush. This just helps aerate the fur and get it dry faster. Okay, you little fluff butt, you're all done. Next in line, Topanga. Plugging the sink, making sure that it's nice, fresh water for her. And then dunk. Dunk her in the bath. Yeah, I know, butt baths are not a kitten's favorite. Now that her butt has soaked, I just use a little bit of baby shampoo to suds it up. I know. Am I making you get a butt bath on YouTube? Yeah, I'm sorry. So what I'm doing is just rubbing the butt. You may find that sometimes when you're rubbing their butt, it actually stimulates them to go poop in the bath. And while that's a little gross, no better place to poop than when you're already getting a butt bath, right? It's okay, Topanga. We all poop in the bath, right, guys? Now it's time to rinse the booty. You can see only her back end has been washed, so I just take a washcloth and I vigorously rub that area to get it dry. What did you do this weekend, Topanga? I just had a little spa day with the girls, you know, got my butt washed. The huge. Once the butt is as dry as it's gonna get, you can use a toothbrush to back comb. Great job! My next customer at the booty spa is Catalina. Baby shampoo. So one precaution, you never want to bathe a kitten who's really sick. Stress can have a major impact on illness, and if the kitten is already not doing well, you don't want to stress them out too bad. So if you have a kitten who's really sick already, I don't recommend dunking them in water. I recommend instead just using your baby wipes or using a gentle wet washcloth to give them a sponge bath. Rinse the booty. Nice and clean. I definitely don't recommend doing this every day. I would try to limit it to once or twice a week since it can be pretty stressful for them. Hopefully they're not going to be having too many poop explosions on themselves, but if they are, then giving them a little oopsie poopsie bath is a very helpful thing to do. Now sometimes people will ask, can you use a hairdryer on these little guys? And the answer is yes, you can, but sparingly, only as needed, and from very far away on a low setting. If you do plan to use a hairdryer, do it from very far away, something like this. We gave your booty a blowout, girlfriend. Okay, Will's getting his booty soaked. You're purring, you kind of like that, huh? You are the most crustable of them all. He eats a ton and he poops a ton. Yeah, you're the tiniest, but you're the biggest pooper. You seem to have a lot of complaints. Hope you don't give me a 1-star rating on my butt spa. You did a great job, buddy. You did a good job. Okay, dude, check it out. You don't poop on yourself anymore, and I won't give you any more butt baths. Is that a deal? Now that your kittens are nice and dry, they can go back to their nice, cozy, warm blanket and get back to a good, comfortable temperature. Good job, baby.
All right, and that is how you give an oopsie poopsie bath to a kitten. It is recommended. You don't want to be doing an oopsie poopsie bath every single day. As you can kind of tell in the video, it's pretty stressful on the kitten. They can get, kind of restless and, vocal and cry just because it is pretty scary for them, especially the first one. So, if we don't do it every single day, it's, going to be better for them. So we kind of, limit. But obviously, again, it's kind of like a judgment call. Like if they are completely disgustingly dirty for some reason, definitely want to do it, but we kind of want to limit it. If you can kind of help tidy them up with one of those, like organic baby wipes versus having to do a full bath, then that would be, more recommended, just to, not stress them out as much as we possibly can. And then another important thing is you do not want to give a kitten that is sick for any reason one of these baths, just because if, they get too cold of water on them, if they're already feeling sick for whatever reason, it can, cause more of an issue. So we just want to be mindful of that and only be giving any sort of bath in this capacity to a kitten that is healthy and, eating and doing well on its own. And pooping problems. So this is something we encounter pretty regularly with bottle babies because they are, drinking formula. It is not mom's, milk, and, it's a replica, it's like close as we can get to replicating mom's milk in the formula, but it's not the same. So, we do often encounter diarrhea and constipation as a result, just of them having to be on the bottle and having to drink formula versus mother's milk. So kitten poop is typically around a score of 4 to 5. So if you'll see on the diagram to the right-hand side, number 2 is an ideal for an adult cat. Kittens, you're going to see it more 4 or 5. And then as you saw in the video earlier, with the bottle babies that were like about a week old, their poop is like kind of more towards like a 5, where it's a little bit more runny, but still has some form to it. And again, as you saw in the video, it appears mustardy yellow in color for the first few weeks, and then we'll kind of graduate towards a normal, brown that we, all have seen. And again, as she mentioned, the younger they are, they should be pooping a couple times a day, but as they get older, that kind of starts to dwindle down to about once a day. But again, like I mentioned prior to, we do kind of encounter sometimes the constipation where, maybe kittens aren't pooping every single day, maybe every few days, and, to different degrees, that is normal for a kitten, but it is something we want to stay on top of to be able to be monitoring, how often our bottle babies are pooping, because we might need to involve our vet team if, they start to have diarrhea or constipation. So here's just kind of a little bit of a diagram of, what both of these things are. So both diarrhea and constipation can be treatable once a cause is found. However, it can be very dangerous for young kittens if it's not treated in a quick enough time frame. So it is very critical to report your concerns to your foster coordinator so they can discuss with our veterinary team, how we can intervene if, they're either suffering with diarrhea or constipation. So diarrhea, as we have on the slide back here, is going to be a 6 to 7, whereas definitely more so watery, liquidy, no texture. For kittens that are under 2 weeks old, we ask that fosters report it to your coordinator if it's been more than 1 day of them having diarrhea. And then for over 2 weeks old, looks like there's a typo there, but kittens that are over 2 weeks old, we ask that you report it to your foster coordinator if it's been more than 2 days of diarrhea. And then on the flip side, constipation is what we consider if a kitten hasn't pooped in 2+ days, excessive crying or straining when they're being stimulated with a cotton pad, or if they are already at the point where they are starting to become litter box trained, if you notice them in the litter box crying or straining. And then their abdomen appears to be bloated or it's firm to the touch, which you can kind of assess on your own if you gently squeeze their belly between your 2 fingers. Again, keyword very gently, and it causes them to flinch or cry, or it's very firm to the touch and appears like distended, where it kind of is hanging lower off of the kitten's like spine, and it's kind of like falling down there where it's like very heavy, and it just ultimately just looks very uncomfortable for them. So that's what we consider constipation, and we again want our foster coordinators to be notified so we can check in with our vet team how we need to best proceed for that particular kitten. And next up, we're bottle feeding kittens get their names. So other things we need to supply is, of course, feeding. So the picture on the right is ideally, this is what feeding time for a bottle kitten looks like, where they're properly latched, they're content, they're actively suckling. So that's like what ideally it looks like. In reality, that is not always going to be the case. It can be very difficult, especially to start, as kittens, are up until the point, when they come into our care, most of the time they have been used to mom's nipple. A bottle is much different and takes time for them to get used to. Kittens are squirmy, they're loud, they're fussy, they require patience and problem solving, for us to work through this big change that they are currently going through, having to adapt to sucking on something different than what they've been used to. And so with time and patience, for you and your foster to just grasp the concept of bottle feeding. And, again, your foster coordinator would be there to support. And sometimes, we go through this process, when they first get to the shelter, and they might be there, for a few hours. And, sometimes we can start the bottle feeding while they're here with us before they go into foster. But usually there is going to be some troubleshooting, to different degrees when they first go home. And then, hopefully they get the hang of it pretty quick, and then it can, be easier over time. But, we definitely recognize that it's a process, and we just, need to definitely keep in mind that, it just requires a lot of patience for these fosters to, help support them through this big change that they're dealing with. And what do we need supply? Again, is the formula, like we talked about before. The formula on the right is the most often the one that we use through our shelters that we get, donated to us. It's called KMR. So it's a kitten milk replacer. And in terms of how to make it up, you're going to want to follow the instructions on the can for pre-mixed formula. So the one on the bottom is already mixed formula. So it's not powder, it's already liquid, and that can be utilized for, kittens. So you can just kind of follow the instructions right on the can there if you have that one. Most of the time we have formula, the powdered version of it, as that usually is able to be kept longer and easier and comes in a larger quantity. But that one, because it is a powder, we do have to make it up for each and every feeding. So you're typically going to want to do 1 part of the kitten milk replacer with 2 parts water. So again, there's instructions on the can to kind of exactly show, how you should be measuring it out. There's a scoop within that can that you're able to measure things out with. And then sometimes, though, we do have to tweak that ratio. So we do talk to our clinic and a foster coordinator as well. If for some reason your kitten is having some constipation problems, sometimes we have to dilute the formula with more water than what it usually calls for. So usually it's going to be 1 part KMR with 3 parts water if they are having some constipation, to kind of get more liquid in there, as KMR historically just by nature, the way it is and has to be, that sometimes it can cause more constipation than, if a kitten, of course, is, on its mother. So yeah, we have to kind of maybe change up the ratio in those regards. And then in order to kind of like declump the formula, you can use a whisk or a shaker bottle, like a blender bottle that some people, utilize when they go to the gym and they do protein shakes and things like that. Shaker bottles are actually really great to make this formula, and you can kind of shake it up, mix it up, and that breaks up any of the clumps that could get stuck in the bottle or stuck in the kitten's mouth. We definitely want to make sure that there are no clumps when we are feeding it to them, just because if they suckle down and a clump of just powder, that can cause problems. So we just want to be mindful of that it is just purely liquid by the time it is mixed up. And then once you do open that can of the powdered KMR, it must be refrigerated, so it can keep in the fridge itself for 3 months or 6 months if it's kept in the freezer. So each time, when I have formula in my own personal house, I just write the date that I opened it on the top, and then I can discard it when it no longer is good. And then again, like I mentioned before, you do want to make new formula each time. Sometimes you can, keep it for the next feeding, but you definitely don't want to push it in any way, just because it can start to, deteriorate if it's already been mixed and, it sits in the fridge or anything like that. So it's easier to just kind of make a batch of formula each time, depending on how many kittens you have and, how much they're eating at that age. You can kind of, best guess how much formula to make. So you're, ideally not wasting it if you can, avoid it. And then also, again, important, as we touched on before, warmth is, we want to make sure kittens are warm before attempting to feed them, because if you're feeding a cold kitten, that can cause some pretty big health concerns. So we want to make sure that we are never feeding a cold kitten, make sure they're warmed up before we do feed them. The formula itself should be warm, but not too hot. So kind of like we do with human babies, you can test the temperature of the milk itself on the inside of your wrist to ensure safe temperature. If it's too hot for you, it is certainly too hot for them. The formula itself can be heated by either zapping in the microwave for about 5 to 8 seconds, or you can submerge the bottle with the formula in it into a cup of hot water for about 20 to 30 seconds, depending on how fast it works. Whatever is ultimately easier. They both work in the same capacity, but again, you just want to make sure you are testing that formula on, the inside of your wrist before you are offering it to the kitten. All right. And then preparing the nipple. So your foster coordinator will be able to provide you with a bottle or two for use. The nipple that comes on the bottle is not always cut. So you will need to cut a hole in it in yourself, unless it was, used for the kitten already before pickup. If one of the shelter, staff had already started bottle feeding, they'll usually be able to give you the bottle that they were utilizing. But if you are starting with a brand new bottle, you will need to cut a hole in the nipple yourself. So the hole should be big enough that if you hold it upside down, the formula can slowly drop out of it, but it's not so big that it flows out freely. So you want to be able to have it there. So when the kitten is sucking, it's coming out, but it's not just dripping out on its own, because that will be way too fast of a flow for a kitten to be able to swallow on its own and can cause issues. So the way to do that is you can either cut the tip of the nipple off at an angle or make an X-shaped cut right on the top there. You can, I usually recommend starting off with like a smaller cut, test it out, see, what the flow looks like, and then you can make it bigger if it's not, what you are looking for. And then as the kittens grow in age, you can cut the nipple itself slightly larger to increase that flow. So they're, able to, they're not really struggling to pull the milk out of the bottle as they get older. They're able to take bigger mouthfuls. And then on the right side, on the bottom, those are what we refer to as miracle nipples. So those are designed to be more reflective of what a mom cat's nipple actually looks like, and kind of the hole is similar versus the way that the bottle in the top is designed. However, each kitten is different. Sometimes you can have success with a miracle nipple. Sometimes you have better success with a bottle. So, it's kind of just a little bit of trial and error. So if you are using a miracle nipple instead, those are already pre-cut, but you might still need to cut them shorter if the kitten is having difficulty latching, or cut it larger, the hole itself, as the kitten ages, like you would with a normal bottle. And then how feeding looks like. So kittens should they should always be fed on their stomach, never their back. So you do not want to be feeding them like you do a human baby. You want kittens to be visually looking exactly how they would look when they are nursing off of their mom. So that is lying completely flat. That is, having their head up at an angle. And just never on their back, because that can cause them to aspirate. And then you can, once they do, you put the bottle in towards their mouth, and then into their mouth they kind of start to chew around a little bit, or like gum around, and you can gently squeeze that bottle to put milk into the nipple. You hold the bottle at a downward angle, putting the nipple into its mouth. The kitten should ideally start to suckle and hopefully latch. So you're going to see a U shape start to form on their tongue. And then sometimes their ears will start to wiggle as they are sucking in the milk. That's kind of just like between the two of those are like indicating that that is a really good latch. And then you also, while this is happening, you do not want to squeeze the bottle. If the kitten is latched, you want to allow it to pull from the bottle and drink at its own pace. You don't want to force milk into its mouth. If it is, latched and suckling, it will do it at its own comfortable pace. And then again, theme for everything is to have patience. We definitely want, fosters to reach out to us if they have any concerns or, difficulties, getting these guys to latch on there. And then I have another video here for how to help these guys, and it's more like just a visual, demonstration of what I've talked about. So we're going to watch this for about 8 minutes.
Kitten season is here. It's the time of year where kittens are entering shelters in huge numbers, oftentimes without a mother. Most of the time this is because well-meaning people find kittens outside and assume that they've been abandoned, when really the mother is usually right down the block. So if you find a kitten outside and they don't appear to be in immediate danger, please wait at least 2 to 3 hours to see if the mother does return. Nobody's better at taking care of a little kitten than their own mama. But if you've found a kitten and you're sure that she's an orphan, she's going to need special care, and that includes bottle feeding. Whether you've found a kitten outside or signed up to foster for your local shelter, here are my top tips for safely bottle feeding kittens. Are you hungry? Tip number 1, get the right supplies. Motherless neonatal kittens have sensitive systems that require a special kitten formula, not just any dairy product you have in the fridge. It's extremely dangerous to feed a kitten the wrong thing. So please, never feed a kitten something she won't be able to digest. Never feed a kitten cow's milk, condensed milk, soy milk or other dairy alternatives, human baby formula, or even cat milk. Cat milk is a product that's sold at stores as a supplemental treat for adult cats, but it's not kitten formula. Instead, you want to pick up something that says kitten formula, such as one of these products. Kitten formula is specially formulated to provide a proper balance of vitamins, minerals, probiotics, and a caloric pattern that mimics the content of a mother cat's milk. I have links to some of the products that I like at kittenlady.org/supplies. While picking up your kitten formula, you'll also want to pick up a kitten bottle and perhaps an extra set of nipples. Most nipples will not come pre-cut, meaning you'll have to cut a hole in them yourself. There are a lot of different ways that people do this, including cutting an X or cutting a V into the nipple. My preferred method is to cut the nipple on an angle so that just a small hole is visible. Cutting the hole properly is important because it will determine the flow of the formula while the kitten is nursing. To ensure proper flow, test the hole by turning the bottle upside down. The formula should slowly drip out 1 drop at a time if the hole is the correct size. If you turn it upside down and nothing flows out, you need to enlarge the hole. If you turn it upside down and it flows too quickly, then you'll have to try again with a new nipple. Because there's so much room for human error with traditional nipples, I like to recommend a product called a Miracle Nipple. A Miracle Nipple is a specialty product you can buy online. It's a hard rubber nipple with a hole already cut into it, and it can attach to a syringe for smaller kittens or get popped onto a bottle lid like this. These are great because the hole is already cut, so it offers a steady flow, and they come in a few different sizes for different ages of kittens. I have links to these on my website at kittenlady.org/supplies. Okay, so once you have your supplies, it's time for tip number 2, preparing the bottle properly. In order to prepare the bottle properly, you want to make sure that you're making your formula fresh, clump-free, and comfortably warm. You want to make your formula fresh every 1 to 2 feedings to ensure that the formula is safe for consumption, so don't make a big jug of it to serve throughout the day. Follow the preparation instructions for the formula you purchase, and make sure that any powder you don't use gets sealed and put in the refrigerator right away. If you're using a powder formula, mix the powder thoroughly with warm water according to the instructions until it's completely smooth. You might benefit from using a product like a smoothie shaker, which will break up the formula's clumps. It's important that the formula is clump-free because a clump can clog the bottle and result in a lot of frustration for both you and the kitten. Finally, make sure that your formula is the right temperature. You can mix your powder formula with warm water, but if you're using an already mixed formula that you've saved in the fridge, you're going to want to get it to the right temperature before you feed. Some people do this with a quick 8-second zap in the microwave, and other people use a tea kettle method. You can pour boiling water into a mug, place the bottle in the mug, and let it float for about 20 seconds. Shake up the bottle thoroughly and test it on the inside of your wrist to ensure that it's comfortably warm. Remember that if the temperature is too hot or too cold for your skin, it's definitely not the right temperature for a tiny kitten. Once you've got your bottle ready, it's time for tip number 3, properly feeding your kitten. Before you reach for a bottle, make sure that it's safe to feed the kitten. Because kittens cannot self-regulate their body temperature, hypothermia may occur in kittens who are orphaned. If the kitten feels cold to the touch or has a temperature of 95 degrees or less, it's not safe to feed her. Focus on gradually increasing her temperature before attempting to feed. Once the kitten is the appropriate temperature, it's time to bottle feed.
Walmart Plus members save on delivery, gas, plus so much more. Join today.
When you're getting ready to feed a kitten, find a comfortable place to put her in your lap or on a table. Always feed the kitten in a natural, belly-down posture. The kitten should be comfortably lying or seated with her belly towards the floor. You may have seen images in the past of kittens eating on their back like a human baby, but this is very wrong and very dangerous. Feeding a kitten on her back would be like hanging a human from her feet and feeding her a burger. It just doesn't make any sense. Feeding a kitten on her back can cause aspiration, which is where a kitten inhales fluids into the lungs. This is so dangerous, so please, never ever feed a kitten on her back. Think of how a kitten would feed from her mother, on her belly, laying down, or sitting next to the mama. Sit the kitten in your lap or on a table, holding the head steady with your non-dominant hand, and introduce the nipple to her mouth with your dominant hand. Don't be scared to really hold the kitten's head. This is how you're going to help direct her towards the food. Invert the bottle so that the formula can slowly flow into the kitten's mouth, but never forcefully squeeze the bottle into her mouth. Instead, you want her to suckle at her own pace. Ideally, the kitten will latch. Latching is when a kitten makes a U shape with her tongue and suckles to drink the formula. You'll know she's latched when she looks like she's very engaged and active, maybe even with the telltale ear wiggle. Place a finger on her throat to ensure that she's swallowing as she eats. You'll be able to feel each gulp, which will let you know that she's eating properly. Here's what a good latch looks like. So hopefully that's what you're going to get. But just in case, here's tip number 4, how to feed fussy kittens. Ow! Getting that perfect latch feels great, but it doesn't always happen. Here are some tips for what to do if you have a fussy kitten that just doesn't want to cooperate. If the kitten doesn't latch, don't panic. Eating out of the side of the mouth is something that some kittens may do at first. And that's okay as long as she is definitely swallowing, and as long as she doesn't have her premolars or molars yet. Kittens who are 5 weeks or older will have teeth on the side of their mouths that can easily shred a nipple, and they could swallow it and cause a blockage. But younger kittens don't have teeth on the side of their mouth yet. So if they do chew on the nipple on the side of their mouth, it's okay as long as your finger is on their throat and you can feel that they are swallowing. If the kitten is fussy and doesn't seem interested in eating, stop what you're doing and try to figure out what the problem is. Sometimes it's just the posture or the flow of the formula, so make sure that you're feeding in a comfortable position and that there isn't something wrong with the bottle. Is it too hot? Is it too cold? Is the hole in the nipple big enough? Is there a clump blocking the formula from coming out? All of these things can cause a kitten to just not really know what to do, so make sure that everything's working properly. If the kitten is squirmy or disinterested, Remember that it's okay to really handle them. Some people are scared to handle a kitten because of how fragile they are, but you have to remember that the kitten doesn't know what you're trying to do. You have to show them. So hold the head and body stable with one hand.
What's the difference between a service animal and an emotional support pet? Well, a service...
You can even wrap them in a blanket if need be, using the barbershop technique, like this. This can help the kitten stay focused and protect your hands from tiny claws at the same time. You can also help the kitten feel ready to bottle feed by brushing her with a toothbrush or by cradling her face in your hand. This simulates the experience of being nuzzled against a mama's fuzzy belly and being groomed, which can help encourage them to eat. Most importantly, remember to be really patient with your kitten. If they're being really fussy, just remember to take it slow and help solve the problem. It's so important that we get some food in these little guys every couple hours, and you're the only hope they have, so try to be patient with them. Okay, so tip number 5, feed the right amount and the right frequency. Young kittens require frequent feeding, so be prepared to care for them around the clock until they're about 5 or 6 weeks of age and weaning onto wet food. For the first few weeks of life, that will mean waking up in the middle of the night to feed. Try not to be intimidated by having to wake up in the middle of the night. Even though the care is frequent, it only takes a few minutes of your time, and it makes a huge difference for the little guys. Having small amounts of food every few hours is going to help keep them hydrated and keep them balanced with nutrients and fat that they need for rapid development and weight gain. You'll see that as the kittens get older, the amount they eat will increase, but the frequency of feeding will decrease. That means that the older the kittens are, the longer of a break you'll get between feeding. You can use this feeding chart to determine how much your kitten should be eating and how often. Just remember that each kitten is different, so this is just a guideline, not a rule book. Some kittens vary in weight and development, so use your best judgment while keeping this guide in mind as a helpful baseline. Tip number 6. Monitor the kitten's progress. Make sure that you have a small digital scale on hand and weigh them daily so that you can monitor how they're doing. Having their weight will help you determine their stomach capacity and how often they should be eating, but it will also help alert you if something's going wrong. Keeping track of a kitten's weight is a great way to ensure that the kitten is making the necessary gains. Weigh the kitten at least once a day and write down her weight in grams. She should be gaining at least 10 grams per day. If the kitten is not gaining weight or if she loses weight, seek immediate veterinary support. My last tip is to remember that it doesn't stop at bottle feeding. You will also be tasked with stimulating the kitten to go to the bathroom, tending to her medical needs, keeping her warm and clean, and otherwise providing her with a safe and secure environment until she's old enough for adoption. After feeding, wipe down the kitten's face so that no formula is sticking to her fur. Gently rub the kitten's genitals with a soft tissue to stimulate her to urinate and defecate. Do this at each feeding, being mindful to wipe up afterwards so that she stays clean and comfortable. Once the kitten has been fed, stimulated, and cleaned up, it's time for her to go back to her warm, safe space until the next feeding.
And the next video I'm going to show you guys is how to help with some troubleshooting. So we're going to tackle that one. So troubleshooting tips, and there'll be some visuals in her next video that I'll show you guys. But troubleshooting tips for guys that are fussy. So it's important never to force KMR into a kitten's mouth at a really, forcing pace. You can kind of dribble a little bit in there, but you definitely don't want to be putting any, significant amount into their mouth without them actively swallowing it. So you can hold the kitten's head firmly while placing the bottle or, the syringe like is highlighted in that photo above, while placing that in their mouth. Sometimes they are just too wiggly, like she said, and, you can hold their heads and we can, guide them to locate the bottle just because their heads are flailing, they're hungry, their feet are going around and kind of in different directions. So they might just kind of need a little bit more of a harder hand to kind of keep their head still to be able to kind of put the nipple and the bottle and everything into their mouth. If the kitten is not latching or suckling, you can squirt a very small amount into its mouth, but you do want to make sure that that mouth is swallowed before you are continuing. And the way that she was showing it in the video is to kind of utilize your fingers and just have one of the fingers placed on the kitten's throat and you can feel it start to swallow. Younger babies might do better with a syringe and a nipple attached, as she is doing in the picture above, versus the bottle. Those syringes allow you to have more precise control over the amount that they are getting, and you can more visually see that. But then also from just the way that you hold it with your hand, sometimes it can be a little bit easier to be able to manipulate a syringe versus a larger bottle, especially when the kittens are really, really young. It's a little bit easier to start off with that versus using a regular bottle. But again, it does take some trial and error. So you can try a different nipple. You can try the regular bottle nipple like she had versus, the miracle nipple that she mentioned. So yeah, it takes just some troubleshooting to, figure out what works best for that particular kitten. And then also, again, like she mentioned in the video, too much formula given too quickly, especially, if the nipple is cut too large accidentally, that can cause a kitten to aspirate. So if you see formula coming out of a kitten's nose, you want to stop feeding it immediately. You want to tilt the kitten's nose down to enable it to sneeze that formula out and kind of, rub their nose and clear out what they accidentally, inhaled versus swallowed. And then again, you can gently wipe that formula off of a kitten's face, and you do not want to resume feeding until you are sure that the nasal passage is clear and that they are breathing normally. They do not appear to be in distress. But however, if they do aspirate more than twice, it is something that we do consider more of an emergency, and you definitely do not want to try feeding them again, because there could be something, going on internally that is causing them to inhale it versus swallow like they should be doing. And the aspiration itself can lead to pneumonia or other respiratory issues, which can ultimately be fatal to kittens. So we definitely just want to keep a very close eye. And again, being extremely mindful how we are bottle feeding them, especially as they are trying to figure out how to make this adjustment. And then another video, so she kind of highlights some different tips and tricks on how to, help these tricky bottle babies figure it out. So let's see here.
Hi guys! Hello! If you're caring for a motherless kitten, you already know you're going to have to bottle feed. And if you're a first-time bottle feeder, I recommend checking out my videos on how to properly bottle feed. But for this video, we're gonna dive a little bit deeper and talk about what to do when you have a bottle baby who isn't good at eating on a bottle. For this video, I'm going to share my top 10 tips for feeding tricky bottle babies. Whoop! Before we begin, a precaution. Never feed a kitten who is lethargic, unresponsive, unable to swallow, or cold. When a kitten is cold, she can't properly latch, swallow, or digest her food. So you want to keep a gentle heat source in your kitten's area at all times. And if you've just taken this kitten in, make sure they're in their heated area for at least 30 minutes before trying to feed them. It's really dangerous to feed a kitten who is cold. And of course, if the kitten is lethargic, unresponsive, or unable to swallow, it is dangerous to put food in their mouth. Never bottle feed a kitten unless she is warm, responsive, and able to swallow. So if you have a bottle baby who's just not a great eater, it can be risky. If you have a kitten who isn't latching properly, there's an increased risk of aspiration, which is where formula accidentally goes down the trachea and into the lungs. This can cause pneumonia or even death. If you're bottle feeding a kitten who's having a hard time latching and swallowing, stop what you're doing and try some of the tips in this video. Okay, so here are my 10 tips for feeding tricky bottle babies. First, be patient. I know it can be frustrating when a kitten is struggling to eat, but never rush the situation. If you've just rescued the kitten, keep in mind that she'll have no experience on a bottle, and bottle feeding doesn't come naturally at first. In this video, you can see my new kitten, Dollop, trying to bottle feed for the first time. She's awkward and unsure of what to do, and that's okay and normal. After a few feedings, she's a pro. So if you're having a hard time getting her to latch, it doesn't hurt to stop what you're doing, take a deep breath, and try again. You might even leave the kitten for 5 minutes, give you both a chance to reset, and then try again. My second tip is to comfort them and feed them upon waking. Research shows that the suckling reflex is strongest the moment that kittens wake up. So if you've got a tricky baby, try mimicking the way they would eat from their mama. They would be asleep, the mama would wake them up by licking, and then they would instantly start to root around, find a nipple, and suckle. So you can mimic this by waking them up with a gentle toothbrushing, and then instantly show them that nice warm bottle. The third piece of advice is to feed them in their warm bed. In the wild, a mama cat will hide her babies in a nice, cozy, warm nesting area, and that's where they'll stay for the first weeks of life. But when we foster kittens, we might take them out of their nesting area and plop them onto a cold table or into our lap, and that's not really natural for them. So something that might help is feeding them in their warm, cozy nesting box where they feel most comfortable and at ease. My next piece of advice is to partially cover their eyes. Think of the experience of nursing from mom. They're not in a brightly lit area walking up and sucking out of a straw. They're nuzzled in her fur, their eyes are going to be covered or partially covered, and it's kind of a dark and comforting place. Covering an eye with your hand not only gives kittens a little bit of that comfort and darkness, but it also might induce those natural rooting and suckling instincts. My next piece of advice is to give them a cuddly companion. To mimic the comfort of being with mom, you can actually give them a stuffed animal who's with them at all times. This is Kabu's stuffed animal, and it even has a battery-operated heartbeat inside, which is so comforting for her. So she's with this thing all the time, and she's used to how it feels and how it smells. It's really cozy for her. It's easy to see that Kabu loves her stuffed animal mama, and so it can be nice to give her this while she's actually nursing. You can take the kitten and plop them right on top of their stuffed animal companion while they have their bottle. Kabu's already rooting around looking for food. You looking for food? Not yet, little one. Or if you really want to get creative, you can get yourself some plush gloves. These also mimic the comfort of a mama. Next up, you might want to try to swaddle the kitten. Sometimes kittens have limbs flying all over the place while they're trying to feed. They're super frantic and energetic, and they can't quite focus on the bottle. If you have one of these little Tasmanian devil kittens, I recommend swaddling. You can take a small baby blanket and you can either burrito them or barbershop them. A burrito is just a gentle wrap around the kitten, and a barbershop wrap is just gently wrapping a blanket around the throat as if they were getting their hair done at a barbershop. Gently containing the arms in this way can help the kitten feel a little bit more focused and directed towards the bottle. Barbershop Kabu. Good job. Never choke or wrap the kitten too tightly. I think you think that's kind of cozy, huh? Yeah, that's pretty cozy. It may sound strange, but some kittens are more incentivized to latch when they're competing against other littermates for a nipple. So with kittens who are having a really hard time latching on, I will feed them in the presence of all of the other kittens, which makes them more competitive and makes them latch better. This technique really works wonders. Here you can see that the kittens are leaping over each other, competing for that nipple. Some kittens are just competitive eaters. Tip number 8 is to check for user error. Make sure that the problem isn't something on your end. Maybe the nipple on the bottle has a hole that's been cut too small or too big. Maybe the formula is clumpy and it's clogging up the end of the bottle. When a kitten is drinking breast milk from their mom, it's going to be nice and warm because it's coming from her warm body. So you never want to try to feed a kitten formula that's really chilly or even room temperature. You do want it to be warm, but not too hot either. Check it on your wrist. Make sure it's not too cold and not too hot. If a kitten's not taking to the bottle, you might try syringe feeding. This can be really good, especially for very little kittens whose eyes are still closed. It's a smaller amount and it's easier to measure. Just be careful while syringe feeding because it does increase the risk of aspiration since you are the one controlling the flow. Go very slowly, just one drop at a time, and ensure that she is truly swallowing. These oral syringes should be washed after use, but also replaced frequently. An overused oral syringe can get very tacky and it can skip dangerously flooding the kitten's mouth with formula. So if you have a really little one who's having a hard time on a bottle, don't be scared to try a syringe. Just go nice and slow, keep it clean, and make sure that they are swallowing every single drop. I think she fell asleep. Did you fall asleep? She's asleep. My last piece of advice is to check the kitten's teeth. You want to make sure the kitten is at an age where she actually needs a bottle, which is going to be 5 weeks and younger. To check if your kitten is 5 weeks old, you can gently open up the mouth and look at the teeth. You want to be looking for premolars on the side of the mouth. If premolars are present, that kitten is at least 5 weeks old, and she might not be bottle feeding because she doesn't need to be bottle feeding. She can wean onto wet food. So try giving that kitten some meaty wet food and see if she likes that. But a kitten who's 3 weeks old, like Kabu, is not going to have those telltale teeth on the side of the mouth that say they're ready for weaning. So if you have a kitten who's under 5 weeks old, you will have to find a way to get this formula into their mouth safely.
But you're not ready for wet food. You're just a little baby. You like your bottle.
So those are 10 things to try if you have a tricky bottle baby. Remember to always feed your kitten with one finger on the throat to feel for swallowing. If she isn't swallowing properly, she could be at risk for aspiration, so be very, very careful. Finally, I do want to mention that there are situations where a kitten cannot swallow on their own or can't really safely handle being bottle fed. Watch this video of my very sick kitten Ray being syringe fed. You can clearly see that he's not in a good position to be fed on his own. He's lethargic, emaciated, and in clear pain. He swallows drop by drop, but just barely. With a kitten in this rough of shape, I will resort to tube feeding, which is a skill that can only be taught in person from an experienced tube feeder. Tube feeding cannot be learned online, so please do not try this without being taught by a professional in person. Tube feeding is something that requires specialized knowledge and supplies, but it's something I highly recommend learning if you plan on fostering critical kittens in an ongoing manner. So if you want to learn this more advanced skill, talk to a veterinarian, a vet tech, or an experienced neonatal kitten caregiver. For a kitten like Ray, a few meals of tube feeding can be all it takes to get him over the hump until he can recover enough to eat independently. I'm a big fan of tube feeding when it comes to critical kittens who can't swallow on their own, because for a kitten like Ray, I've seen it totally transform their life. But in a perfect world, you don't have to do that. Ideally, you'll be able to use the tips in this video to get your kitten to latch beautifully and swallow that formula. Don't forget to weigh the kitten at every feeding to monitor her progress. And hopefully before you know it, that kitten will be chunky and growing beautifully. Look at that chunky belly. Best of luck, and thanks for watching.
Right, so that covers a lot of what could, kind of be going on that might cause, some of these guys to be a little bit more tricky than others. So usually with all those different, ideas and tips and tricks, we can get them to figure it out. But yeah, it just, takes patience and time and just, some work on our end to get them to, help figure it out. And so weight and feeding chart for kittens. So with these guys, it is exceptionally important to be monitoring their weights every single day. If they are, between 0 to 2 weeks old, multiple times a day is always a good idea, just because it's the best way to track how they are doing and how they are growing. So kittens can drop weight within the first 24 hours after they are born. After that first day, they should be gaining 10 to 15 grams, about half an ounce per day. So there's a weight chart kind of with feeding amounts on that right-hand side up top. That kind of shows age range, what is the normal for a kitten at that age and that size to be eating, their schedule, and what the average weight is. Again, every kitten is different, so it is an estimate, amount for feeding and can be adjusted depending on the kitten. So as I mentioned too, weighing kittens at the same time each day, maybe multiple times a day if they are super young, just to stay on top of things. They should be weighed ideally in a bowl. So there should be a bowl on the kitten in that bottom photo there, just because it's easier for them to be kind of enclosed in there for proper weight measurement on top of the kitten scale. So if you have a kitchen scale at home, you can certainly utilize that and utilize a bowl to kind of plop them in. Or if you do need one, your foster coordinator will certainly be able to provide you with one. So with kittens, when you are using that scale, if you put a bowl on there, you just want to make sure you are zeroing out the scale. So you're taking away the weight of that particular bowl and you're only weighing the weight of the kitten. So you can zero out or tar the scale to make it 0 while it has the bowl on there before you put the kitten in there. And so the kittens should be continuously gaining, but sometimes they can plateau or lose weight. That is, sometimes normal if they go maybe a day or two with a plateau, but we'll talk on it further, when it is something that is a concern, and you definitely need to report it to your foster coordinator for us to be able to intervene medically if something could potentially going on. And then weaning. So a great time, you're at kind of the light at the end of the tunnel, the long bottle baby 24/7 feeding schedule tunnel. This happens at around 4 weeks old. Again, that is a rough estimate. Every kitten is a little bit different. So this can kind of start when they're like 3.5. It could start maybe when they're 5.5. Each kitten is an individual. So, it's just kind of a rough estimate as to, when typically that time frame starts to take place, and you can start to offer, kittens a small amount of canned food. So what we recommend doing, and again, there will be a video on it from Kitten Lady to kind of show this more in a visual standpoint too, but you're going to want to start by mixing a small amount of canned food or Science Diet AD, which is a prescription diet for some kittens that are maybe too small and, they need a little bit more of higher calories. So that is something to discuss with your foster coordinator. And we might recommend mixing in some AD versus just normal kitten formula or kitten food. So you're going to want to mix whatever wet food in with formula to make what we call a slurry. So you're going to start out with mixing more liquid, less of the wet food, and you kind of make it more like of a soup consistency, and then you'll work your way more towards chunky as the kittens start to figure it out. So you start with more liquidy, more slurry, and you can kind of make it a little bit more chunky as time goes on, as they start to figure it out and start to wean out the formula and kind of get them on, a slow transition over to only wet food. So there's a few different ways you can kind of start doing this, but one of them is going to be to begin by feeding it from a bowl or a shallow dish or a plate, some sort of, relatively low container to put the slurry in, where, ideally it has a little bit of a lip to it sometimes, so the kittens aren't just going to be walking straight through it. But this is a very messy time. So there's going to be a mess. There's going to be wet food, usually all over the kitten and, sometimes all over the floor. So if you want to put like a pee pad down or, something on your floor, if you're using carpet to kind of keep things clean, this is just a messy thing. And it's just always going to be a messy thing for this age range as they start to figure it out. But when you are using a container for it, you do want to make sure the edges are not sharp, as the kittens are typically going to be biting at those edges. Kind of, they start to do like a suckling on the walls of the container. Sometimes they'll start to try to suckle the edges of the container. So having it just be smooth, so when they do bite down on things, it's not going to hurt them. And then sometimes what we found to be helpful as well is you can use your finger to kind of dunk your finger, as gross as it is, you're going to dunk your finger in the slurry, and you can kind of put that just up to the kitten's face, up to their mouth, and, just watch your fingers while you're doing it, because if they get really curious and excited and they're really hungry, they're going to nibble your finger. So they might bite down on the food and they'll get you. So just be mindful of that while you're kind of doing that method. But we found it to be really successful, and you can kind of use your finger if they're really curious and they're looking at your finger or nibbling it a little bit. You can use your finger and kind of guide their mouth down to the bowl. And then once they're kind of more into that, you can remove your finger, and usually they just kind of need a little bit of like an instruction and kind of just guidance from a visual standpoint of like, here is your food, you need to eat this, versus nibbling my finger. But it's kind of just like that guidance has definitely been pretty helpful to get kittens to kind of, know where they're going and what they're, where they're supposed to put their mouths. And then, as I kind of mentioned before, you can gradually increase the ratio of canned food versus the formula. So you kind of go from that really watery slurry over to more solid or, chunky, less, formed type of food that, they're going to ultimately be eating as an adult. You want to make sure the kittens are actually eating, not just suckling on the food. And then again, during this time, as always, we're going to be watching for diarrhea. You might need to supplement with a bottle for a few days while the kittens are figuring it out. So like I said, if they are typically going to start by investigating the food, investigating the dish, and they're just going to be kind of suckling around and kind of like rooting around, but they're not necessarily eating the food. They're kind of just like mushing their face into it. So you definitely want to stay on top of making sure they are getting full meals. So we kind of have to continue to bottle feed them during this time and, kind of supplement with the food. And then kind of, again, it's more like a gradual transition. So the best way to kind of ensure that they are getting those full meals is to be staying on top of weight monitoring. That can kind of pinpoint if maybe one kitten's not getting a full meal. If, they maybe stop gaining weight for a day, then we can kind of, start to go back to supplementing, bottle feeding more. And then, kind of just takes time. So again, the theme of all of this is always just having patience, but you're definitely at the light at the end of the bottle baby tunnel. And then again, as a reminder, each kitten develops at its own pace. So if you have a couple bottle babies, you might notice one start to, progress versus another one. So it's, again, like a rough estimate at what age this does tend to happen at, but usually it's going to be between 3.5, 4, 5, 5.5 weeks old as they figure it out. Then I have another video here of how to wean kittens, and she uses another method, which is also really great, utilizing a bottle to feed the slurry. So I will play this for you guys for about 7 minutes. And yeah, she kind of shows visually what works.
Hey everyone, I'm in my kitten dress. Woo! Today I'm going to teach you guys all about weaning kittens. Weaning is the process of transitioning from the nursing stage to eating independently. So if you're raising orphan kittens, you've been bottle feeding them, but eventually once they're old enough and healthy enough, you're going to want to start the weaning process. For most orphans, the weaning process starts around 4 to 4.5 weeks of age, but this is going to vary depending on their weight, their behavior, and their health. In this video, I'm going to show you guys my 3-step weaning process to take kittens from bottle feeding to eating independently in 1 week. In step 1, I'm going to show you guys how to start introducing slurry in a bottle. So the supplies you're going to need for weaning are going to be first the formula that you've already had the kittens on, and then you're going to want the food that you're going to transition them onto, which should be a wet kitten food. Make sure that it's a can and make sure it says kitten on it. So what I'm going to do to wean them is I'm going to start to create what I call a slurry. Slurry is just a mix of what they were on and what they're going to. So what I have started to do is actually mix their slurry in a blender bottle and then feed it to them in the way that they recognize, which is a bottle. This method is going to help introduce to them the new food and the new proteins without it being a confusing and messy process for them. First, just make formula like you usually would, but make it in a blender bottle. A blender bottle is a smoothie bottle that has a little metal ball in it, and it helps shake up everything and keep it clump free. So I'm going to get some warm water going. Make sure that you make the formula to the specifications on your product. So this is 1 part formula and 2 parts warm water. Okay, so I've got my formula and my water in the blender bottle, and now I'm going to add my wet kitten food. So I'm going to introduce about half a can. Make sure the top is on tight, and then shake it. So now we've got our slurry. I'm going to pour this into their bottle. And you can see it made a very, very smooth consistency. It's almost like a naked juice, but kind of gross, full of kitten food and formula. Alright, so we're going to start with Fritter. And Fritter is about 4.5 weeks old. So you would want to wean them at the right age, of course. You can wean way too early and it can be really dangerous for them. So I always start around 4 to 4.5 weeks old. He's been on the bottle since he was about 2 weeks old, so he's really comfortable like this, but this is helping him learn about meat. The blender bottle is so awesome because it helps reduce any chunks. It's a really smooth slurry for them and a really nice transition. Was that good? Refill! Jelly is the smallest of the litter. She is also about 4.5 weeks old, and she is a really good bottle feeder. I love the weaning phase with kittens because they kind of have this moment of realization once they eat meat where they go, wait a minute, I am a tiny predator, and they totally become crazy. Jelly's a little sloppy, but I promise you it's much sloppier if you try to do this in a dish the first time they eat. Meat bottle, meat bottle, meat bottle, meat bottle. Are you a predator? Yeah, that's good stuff. That's the big kid stuff. Last but not least, big boy bear claw. So you only want to wean kittens when you know that they're in good health. If they are showing signs that they're already having a hard time eating, just keep them on what they're on. If they're healthy, between 4 and 4.5 weeks is a great time to start. Mr. Perfect! Oh, I just want to eat you. So with a slurry bottle, you can gradually change the ratio of the meat and formula so that they become more and more accustomed to eating the new food. I usually give kittens a slurry bottle for about 2 to 3 days when I'm weaning them. Once they're totally comfortable with that, I move on to step 2, teaching them how to eat slurry out of a dish. For phase 2 of weaning, we're going to teach them how to eat out of a dish. I recommend that you get a very, very shallow dish, something that is really, really short, like 1 inch short, almost like a plate with a lip. Another thing I recommend is puppy pads. They don't always understand what you're trying to do when you show them a dish of food for the first time, so a lot of the time they can end up walking through it, causing a huge mess. So now we're going to make our slurry. We're going to do a mixture again of the formula that they've been eating and a wet food that says kitten on it. So I don't recommend making your slurry too liquidy. I recommend making it a little bit chunky, a little bit thick, almost more like the texture of homemade hummus or something like that, so that they have something they can really wrap their teeth around. Don't forget that they might not understand this the first time, so you also want to prepare a standard bottle like you've been doing just to supplement. So kittens get so used to associating your hands with food that when you show them a bowl, they often still go for your hands, thinking that that's where the food is. Of course, that makes sense because for an orphan, they think of your hands kind of as their mom. So they probably will understand that there's food in there, they just might not understand fully how to get it. Wow! So this is awesome. Bear Claw and Fritter are understanding it right away. Well, Fritter is standing in it with his 2 front paws, which is why we have the pee pads. Jelly, do you understand it? So you can see Jelly's very hungry, but she doesn't understand what they're doing. She is the smallest of the litter, and this is more typical to what I would see, is them just really not getting it. So if you have a kitten that's not understanding, you can actually feed them some on your finger, because they're much more likely to understand it if it's on your hand. So Jelly's eating it off my finger. This is how I get them into the dish, is actually to show it to them on my finger, and then just gradually put my finger into the dish. So look at that, now she's in there. She's still eating it off my hand and not out of the dish. But if I keep scooping it and then slowly move my finger away, voila! This is a beautiful sight. This means you're so close to being done bottle feeding. Now, if you're not sure that they got a full meal's worth, you can also supplement with the bottle still. So I did make them a bottle just in case. Jelly, did you get enough? So remember, you want them to still get a full meal. If they didn't totally understand it, still supplement with the bottle until you're sure that they're getting as much food as they need.
I love you guys.
You're so smart. Woohoo! The last step is to seal the deal and give them just wet food in a dish. You only want to do this when they're totally ready and they're confidently eating slurry. At this point, you can also introduce water to them. Hi, babies. Are you guys hungry? All right, so this is phase 3. I'm going to put them on their new diet, which is just a can of wet kitten food with a little bit of water mixed into it. Let's see if you guys can do this. Are you ready? I think they're ready. Yay! We did it! They might still step in it a little bit. That's okay. This is why we have the pee pads. It's a little messy, but look at this progress. So in just 1 week, we got them from being on a bottle to being on a slurry bottle to eating slurry out of a dish, and now they are fully transitioned to their wet food diet. This is so awesome because once they're fully accustomed to this, they are going to be on their way to getting adopted. Remember that this can be a messy and slow process, but don't lose hope. So don't take an attitude like, if you don't eat this, you don't eat anything. There's no such thing as tough love for kittens. So meet them where they are. Don't forget, you can learn so much more at kittenlady.org. Happy weaning!
All right, and that is how she has found success doing weaning. So really, you can kind of figure out what works best for you, but then also, your foster kitten. There's no, tried and true method. It's just, whatever works better for the kittens, it is fine. And, we just, want everyone to have all the tools that they can, to help try to make this process as smoothly, as it can go for these guys. And then litter box training. So this also begins at around 4 weeks old. So we, recommend putting a litter box in the crate with them. So kind of by that age, they will have graduated from that top loading carrier, like before that we covered, into like maybe more of a playpen situation or like a larger crate where, they can have more room to roam around and stuff like that. So you can put a litter box and start to introduce that to them around that time frame. You want to be using either a pellet litter or a non-clumping clay litter. If you are using clay litter, you want to definitely at first to be monitoring them very closely while they are around that litter to ensure that they are not trying to eat it. If you do notice they are trying to eat it, you do want to be able to switch over to a pelleted litter as soon as possible, or remove the litter box until you're able to get a different type of litter, which is just larger and less, they're not able to actually ingest it. Kittens think, litter and a litter box is going to be a toy when they first encounter it. So sometimes they can just become more curious and they'll kind of explore utilizing their mouth instead. And in terms of the litter box itself, you can utilize either a cardboard box. We've, utilized bottoms of a case of wet food in the past, and that has been really successful for quick and easy cleanup. Or you can also use like a smaller plastic or a metal litter box that, it's just easier from a, just to be able to actually clean it to reuse. But if you want to use a cardboard box, you can just discard those used ones as well. So kind of, again, whatever works best for you and your setup as well as the kitten, certainly works. We just want to, have some options out there for folks to try out. And then you can also put a soiled cotton ball or cotton pad or whatever you have been using to stimulate the kittens. You can put that into the box with them. You can gently take a paw and scratch at the litter to kind of, get them to root around and investigate it a little bit more as well. And then again, oftentimes kittens are going to play around in this. They think it's a fun new toy, but eventually instincts will kick in and they will focus and be able to start going on their own. It does require trial and error and patience, as they are bound to have accidents, especially depending on the type of, housing situation they're in. I do, again, recommend some sort of playpen situation or larger crate at this point in time. But if they are having some supervised outside of the pen time, in a room or whatnot, if it is a larger space, they are, bound to have accidents, just because if they get too far away from their litter box while they are figuring it out, especially in a larger space, they will probably, just be going where they are, more physically located. So it is a good idea, especially with multiple kittens, to have multiple litter boxes if it is a larger space, just so they don't have to be able to travel far to actually be able to get access to one. And then you do want to ensure kittens are kept clean and to do a butt bath if they do make a mess of themselves. And you can use a dry toothbrush to, help dry off their fur after you do clean them up. Just because, especially if they're having like a bout of diarrhea or something, they're pretty often they're going to walk through it, or, they'll get it kind of stuck to their backside a little bit there. And then bottle baby health concerns. So orphan kitten emergencies, non-emergency versus emergency. So what we kind of consider, urgent, but, nothing that, needs necessarily immediate medical intervention is going to be constipation or diarrhea, which, pooping problems that we already covered, not suckling despite troubleshooting. So if the kitten is not able to latch onto a bottle or the syringe, despite all of the different recommendations to try to troubleshoot, there could be something going on, maybe from a developmental standpoint that is preventing them from being able to successfully do that. Weight loss for more than 2 days. Kittens under 2 weeks old, we ask that fosters report it if the loss is for more than 1 day, as again, we want to be able to intervene because that can be, indicative of something else going on, and, also indicative of them not being able to suckle properly and be able to take in those nutrients. Weight plateau for more than 2 days. So if they just get stuck at a certain weight, we might need to get creative and kind of intervene to, somehow get more calories into them. Sneezing, eye or nose discharge, hair loss or scabs, visible parasites in their stool, visible parasites on their hair coat, limping or injured. And then emergencies, which need, definitely as soon as possible medical intervention, is going to be listlessness, non-responsive, if they cannot lift their head, if they're completely lethargic, they're continuing to rapidly lose weight. So, not necessarily a gradual weight loss for more than 2 days, but if they just kind of suddenly things go downhill really quickly, they're gasping for breath, or, any sort of respiratory distress, seizures, facial swelling, allergic reaction, or toxic ingestion. And then in terms of the emergency protocols, you will have already been provided those by this point, but just to kind of go over them again here, during business hours, Monday through Friday, if your pet is experiencing a medical emergency during those hours, you can contact your foster coordinator. Depending on the severity of the situation, we will assess the urgency and the severity of it. We might direct you to head directly to the emergency room if, it's just a matter of timing and, what is happening in our clinic. We'll be able to provide the best path forward to get your foster the care that it needs. Emergencies off business hours, so either overnight emergencies or weekend hours that are not the Monday through Friday, typical 7 to 4 type of hours. If your foster is experiencing a medical emergency after hours, you are able to head directly to one of our Angell locations, both in Boston or Waltham. Once you have arrived, you can contact your foster coordinator, just send them an email to make them aware of the visit, and then the foster coordinators will follow up, as soon as possible once they are back at work. And sometimes it is a good idea also to just give the Angell emergency room a call prior to heading there as well, just because sometimes they are able to provide some guidance or counsel, triage depending on the situation. So definitely, if you ever have a concern, that is an emergency to you, you can certainly call them as well, to kind of, get their opinion as to, what the situation is. They'll be able to also provide a best path forward to get your pet the care that it needs. And then the vaccine and spay and neuter schedule. At 4 weeks old, bottle babies will come in for their first vaccine appointment. They are going to receive their first distemper vaccine, which we call FVRCP. It's just a very overarching vaccine that covers a lot of feline diseases that can come up. So we start their first booster at that age range. They get some dewormer as well during that time frame. A month later, the kittens will return to receive their second distemper vaccine, another round of dewormer. Usually your foster coordinator is also going to send you with a dewormer to give in between that time frame. So kittens are going to be giving dewormer every 2 weeks. And then at that appointment as well, they're going to get flea and tick preventative. If the kittens are big enough, they're going to get a feline leukemia test, which is a blood draw from the inner back leg of that kitten. Sometimes we might elect to hold off on this test until spay and neuters, but that's, at the discretion of your foster coordinator at that point. But sometimes we might do that as well during this appointment. And then at 9-10 weeks old, depending on kind of our surgery schedule, everyone will return for spay and neuter and eventual adoption. And during that appointment, during the spay and neuter and everything, they're going to get their third distemper booster. They're going to get another dewormer. They're going to get flea and tick as well as feline leukemia test if it was not done at that last appointment there.